now.
Good evening, I'm Lauren Colbert.
And I'm Nicholas Pollack. Thank you for watching KX News.
In tonight's top story, North Dakota nursing organizations are speaking out today against the governor's recent announcement. In an effort to address a staffing strain at hospitals, Governor Doug Burgum said that asymptomatic COVID-positive nurses can continue working.
Reporter Maddie Biertemple has more on the measure and why some nurses don't like it.
Monday, the governor announced a measure meant to relieve the strain on hospitals because of COVID-19.
To allow asymptomatic COVID-positive healthcare workers to work in COVID units of licensed healthcare facilities.
North Dakota's Nurses Association president says it's a step too far.
It was a gut punch. The nurses in the state, everywhere, are barely hanging on.
Johnson says the plan would put other nurses at risk and set a bad example for the public who have long been told to stay home if they test positive.
We are a very trusted profession. And so if we are asking people in our communities to close contacts, for instance, to stay home for 14 days or positive people stay home for 14 days, but we're not doing that, what kind of example does that leave?
North Dakota's Emergency Nurses Association President Adam Johnston says that while Burgum's announcement is aligned with CDC crisis guidelines, it should be a last resort.
It may need to come into play. It doesn't make sense to do this out of order without the other approaches, without the other strategies.
Johnston says those other strategies include a statewide mask mandate, which the governor has repeatedly opposed.
We're still one of 16 states that does not have a mask mandate.
However, North Dakota's Long-Term Care Association president says the announcement will help with staffing shortages.
8 months ago, had you asked us about this, it is something I don't think we would have ever thought of supporting. But we find ourselves now 8 months later with a number of COVID-positive residents and a number of COVID-positive staff. And the staffing challenges have been significant.
For it to work, Peterson says staff must want to work, strict policies must be in place to protect all employees, and there should be an approved COVID unit. So far, she thinks there's enough support from employees to make it effective.
We only started to consider this as an option. Is this something we should consider? When, number one, staff went to their administrators and said, hey, there's a need. I would like to work.
Both nursing associations have called for a mask mandate, and both groups say they expect a bleak outlook for hospitals over the winter months if the virus isn't under control.
We're preparing ourselves for a very dark next 6-8 weeks.
We need our numbers to slow down because we're going to be in a world of hurt if they keep going up.
As of Thursday, there are 9 available staffed ICU beds in the entire state. Reporting in Bismarck for KX News, Maddie Biertemple.
And as of today, 697 people have died in North Dakota with COVID-19.
Now to our COVID-19